Dr. Kim. So I'm really excited to talk about this conversation because, everybody knows if they listen to my podcast that, there's so much wrong with women's health and the lack of knowledge and patriarchy and gaslighting. But this subject right here is, it's weird. In medicine, women have been relegated to bikini medicine. So you're basically a set of breasts and your reproductive organs. But when it comes to physical description and activities in the organs and the muscles and all of the things that go into our pelvic region, that's also an area of taboo, and we don't talk about it. We don't talk about our pelvic floor. We don't talk about what is really happening there. And there's so many things that happen as we go through childbirth and, the menopause transition that affects that area. So I'm so excited to have you here today because I think you're going to elucidate a lot of really important things for women to understand. So thank you for being here, Dr. Kim. It's awesome.
Thank you so much for having me. I'm excited to talk about this.
Yeah. So tell me, so obviously you're a physical therapist and, I think almost everybody in this world, comes to whatever their sort of calling or specialty is because they themselves needed it or somebody in their family or somebody close to them, weren't really helped with conventional means. So how did you get into pelvic floor? Because that's a very specific specialty within PT.
Yeah, so I've been a physical therapist for 27 years now. I've done it a long time and had my son 17 years ago. And during labor and delivery, I think I tore my labrum in my hip, but I didn't know it at the time. And I was home with a newborn and I'm laying in bed at night with this just throbbing hip and couldn't figure it out. And so eventually, once I could get myself to the doctor and saw an ortho, he's like, yeah, I think you have a torn labrum in your hip. And I was like, okay, interesting. I didn't realize that could happen during labor and delivery. And at this time, I wasn't a pelvic PT, so I didn't know about like the positioning when you're delivering and things that actually open the pelvis versus close the pelvis. So seeing that ortho gave me some insight into what was going on in my hip, but it kind of propelled me into understanding more and thought, I don't want another woman to have to go through this. If there's a way we can prevent tearing our labrums during delivery, we need to do that. So that started it. And then down the road, I have a 10-year-old and I was very lucky and blessed to have a 10-year-old I have a baby at 40 years old. So, and during that time, I was in perimenopause and postpartum at the same time. And I was like, what the heck was that? Like, I didn't know what it was until after I kind of got through it. Then I was like, oh, that's what that was over there. So that also propelled me down into a deep dive of doing all this research, which was really me search to figure out like what is going on in my body. My hormones are all jacked up. I'm gaining weight. And of course, you don't lose weight the same after the second, but it was really hard. So my kiddos really are what kind of helped me along this path. And then once I learned everything and started talking to all my friends and patients, they're like, no one has ever told me this. I didn't know about this. So then I thought, this is my passion. This is my mission. I want to share this with as many people that will listen.
Oh my gosh. So you just unpacked so much. So number one, you get kudos for having gone through the seventh circle of hell and go through postpartum and enter into perimenopause at the same time. Because both of those are extraordinary hormonal events, and to have that and an infant and obviously another child that you have to take care of. Wow. Like that, you need to have a plaque on the wall for that. We should be handing out awards for passing through time as women. For sure. So, I would have never thought that you could tear a labrum during delivery.
Yeah. So that's one of the things I do now is I help women like when they're pregnant to come in and do some positioning, doing some labor positions, do some hip openers and things like that to help teach them about that. I'm going to grab my pelvis model here. I know on the podcast you won't be able to see this, but basically what we need to know is this part of the pelvis here is the pelvic inlet, and then this is the pelvic outlet where baby comes out. And so we initially need baby to drop down, which requires us to have more external rotation in our hips, and that's why hip mobility is really important. But then as baby's coming out, we actually want our hips to be more in a internal rotation kind of together so that it opens up this area right here so that there's more space for the baby to go through. So just some of those mechanical differences can make a huge impact on delivery and women not sustaining as many traumatic births. I mean, I hear the stories all the time about what women have gone through, and it's very disheartening. And then the trauma, the birth trauma. So if there's things I can do to empower women to make it less painful and have less injury, then that's what I do.
Oh my goodness. So yeah, so I'm going to describe a little bit about what she was kind of talking about is, if you look at a woman's hips, it kind of looks like I always think they almost look like butterfly wings. The top of the hip bones where, where we get our curves from if we're looking from the outside is the top of the hip and the iliac crest. And then you've got sort of the narrow pelvic floor that opens up to let the baby come through. And so you're saying sort of in the beginning, you need to be able to open the top hips open, which is kind of like, I would assume, like if you were laying on your back and you did like happy baby or one of the poses where you're pulling your knees out to the side, and pulling your heels into the pelvis, that opens the top of the hip structure.
Yes.
But then as the baby's pressing through that vaginal canal, you almost need to narrow all of that so the bottom of the opening starts to open up. And that's, no one's ever explained that, and then a lot of times women get, epidurals, so they're not feeling anything. So they can't really judge what's going on. So yes, I've met so many women that are like, yeah, things down there have been completely rearranged, from childbirth.
Yeah. And you bring up a good point, the epidural. So I did have an epidural, and I had zero control over my left leg. So my husband was holding it. And if you look at any labor and delivery positions, almost always you see women laying on their backs with their hips and their legs opened out into external rotation, what we just described. And really, if we could just kind of give some internal rotation to those hips, if you want to educate your partner, whoever's going to be with you in the delivery room, about helping you to have your hip in the right position, that could prevent some of these injuries.
Yeah, so you're kind of saying, so instead of the knees being out wide as the baby's getting into the birth canal, it's almost like putting your knees facing the roof or the ceiling a little bit.
Yeah.
And internal.
And then your ankles are kind of, and your feet are
Out.
wider than your knees.
Yeah, so it's kind of reversing that movement. That's interesting because I've, the other thing I see a lot, and I'm sure you probably do too, is women have back pain. I'm air quoting this back pain. And really what it is it's lower lumbar, but mostly SI joint, sacroiliac joint pain, where they, and along the lines of where the tailbone meet the hips. And because I've injured myself like 3 or 4 times over the course of about 30 years. And one of the things is when that sort of gets out of whack is if I take one of those soft exercise balls and squeeze it, really, really tightly with my knees, and then twist, like with a controlled twist, I can almost put it back in place. But what it's doing is moving that pelvic floor a little bit to allow the realignment. So it is kind of the same thing.
Yeah. Yeah, that's a technique we use. It's called muscle energy technique, where you use certain muscles to help get things to be back in position. And sometimes as simple as a contract, relax technique can improve that alignment. But that can be, if you've ever experienced it, can be pretty painful. And when we're in pregnancy, we have the hormones that are released relaxin, so that SI joint gets really relaxed. It's preparing the body for delivery. And so I also treat women during pregnancy for like pubic symphysis diastasis, where that symphysis is actually separating a bit. And so there's definitely some muscle energy techniques we can use to help engage those muscles and prevent that from getting worse. And yeah, you don't have to have kiddos to have back pain. So like you said, it can happen to any of us. I think 90% of the population at one point in life experiences back pain.
Yeah. Yeah. I mean, I would say my non-specific, non-scientifically measured, 9 times out of 10, it's a hip pelvic something for women. I'm like, it's probably not really in the spine at all. It's probably elsewhere. You need to go to PT. So let's talk a little bit about the structure of the pelvic floor and why it is subject to so many different, malfunctions and pain and things like that for women, because I think we don't really think about the structure of that environment and how it may have an impact on digestion and everything else too.
Yeah, absolutely. So generally, I have my pelvis up again for those that are on the podcast. But basically, there are 3 layers of muscles to the pelvic floor. So we have the outer layer, which is more like the sexual organ muscles. These muscles actually on my model can come off, but it takes a while to screw them off. So we're just going to kind of pretend they're off. And then next layer, there's a second layer, and those are where our sphincter muscles are, and a muscle called the deep transverse perineum muscle that runs right across basically your seat bones. And then the third layer of muscles is your levator ani. It's best to see them this way, looking through the pelvis. And if you think about the levator ani, it's like a bowl that's holding up everything in your pelvis. So these muscles have some tremendous important functions. And it's not as simple as, a lot of times we hear someone's having pelvic floor issues and they Google, go do some Kegels. And unfortunately, sometimes that can make things worse. So I'm happy that people are trying to Google and get the information out there, but oftentimes the pelvic floor can be too tight. And so some women will experience leakage and they automatically think, I'm leaking urine, I need to do more strengthening, I need to get those muscles stronger. But what might be happening is the muscles might actually be too tight. And to have good strength, we need to have length. So often when you come to pelvic PT, if you've been doing Kegels, that may be the first thing we say, we need you to stop doing those. We need to create length in there before we can create strength. So that's one of the things I see a lot is the need for lengthening the muscles and then teaching women how to properly use those muscles with what's called the core canister, which is made up of 4 things. And that's our diaphragm, which is right below our rib cage. And then we have our abdominal muscles, and then we have our pelvic floor. And then the 4th component of that core canister are the multifidus muscles, which are some deep muscles in the spine. So we need all 4 of those muscles groups to work in synchrony so that when we breathe and we do different movements, especially if we do weightlifting, which I really encourage a lot of women to do, it's like a catch and a release, that as we're breathing, like the pressure is going down, we need to catch it and then we need to release it back up. So there's things that deep breathing, just diaphragmatic breathing is a great place to start, just to kind of get more familiar with those muscles and how they feel.
Okay. I have a weird question. You may not have ever had someone ask this, but I'm going to ask it anyway because it popped into my head when you were talking about that. So obviously the pelvic floor, the spinal muscles interior and also the abdominal muscles play so heavily together. When you're squatting, right? Squatting and deadlifting.
Mm-hmm.
Obviously, a lot of times women aren't lifting super, super heavy, although we would recommend lifting heavy for you. In the bodybuilding world, everybody belts up, right? So they put an abdominal belt on, so you got something to push pressure against, and especially if you're lifting really heavy, it's necessary so you don't kind of blow everything out the front of your belly. Would that, though, I'm curious, because I always hated wearing a belt because I'm short-waisted, so it was uncomfortable especially I used to power lift way back when. And would that potentially, that dependency on a or a weighted belt or a weight belt, make those muscles more weak over time, especially like the abdominal muscles and the spiny or the spinal muscles?
Yeah. There was only ever one study that came out that supported wearing back braces, and it was actually a study that was sponsored by Home Depot. And this was many, many years ago. And I think if you would remember, you go into Home Depot, you would see all the guys with these belts on. Mm-hmm. So it's a great idea in theory. The intention is there to protect. But like you said, if your muscles get the sensation of something else doing the job, then they can get a little bit lazy. So it's not, there's very rare cases that I usually recommend using a belt. It's best that we can use our own muscles and learn how to use them properly. And like you brought up the weightlifting, what I see often, and this is some general information because it can get really specific when you're doing like heavy lifting, but generally if you're in a squat position and you're at the bottom and you're about to lift up, like we are taught, like we should be exhaling at the hardest part of a movement typically. There is some also hypopressive breathing as well, but we'll get into that another time. But with that exhale, we want to make sure that our pelvic floor is engaged and things are actually coming up, which for a lot of women, when we're used to, the last time we were told to exhale, we were delivering babies and we were pushing out. So I often tell my clients, this is like one day in time that you do it this way. The rest of the time, you really want to be doing it this way. But having seen thousands of pelvises in women, it's sometimes there are little differences from person to person. But if you're having trouble with any possibly leakage, you might want to just try that when you're in that squat. Go ahead and engage those pelvic floor muscles and try to lift up as you're coming up from that squat. But once again, I've not evaluated your pelvic floor. So if you try to engage, you might actually be making things worse. And that's why it's not as simple as just, going on the internet and finding out what you should do during a squat, because it can be very individualized. But
Yeah,
yeah, that's a
yeah.
great point. It's all about pressure management. I had a friend reach out to me recently asking about a pediatric case, and it's called giggle incontinence. And when the kiddo laughs, they have some leakage. So it's pressure management right there.
Yeah. Yeah.
Then the other piece we didn't talk about, the anatomy. If we think about like a woman's urethra, it's really short and vertical, and it just sits right there, and so there's not much room for error, basically. But if you look at a male's anatomy, they got that 90-degree turn. So we are just kind of designed to have a little bit more. We're more vulnerable to have leakage just based on the design.
Yeah.
And I also use an analogy with the urethra. If our pelvic floor muscles are really tight and taut, and it's like if you had a garden hose and it had water in it and it was sitting on the driveway and it's a real hard, firm surface, you step on that hose, that water's going to come out. But if that hose was sitting on a soft, mushy, muddy area and you stepped on it, there'd be more shock absorption, if you will. So you're less likely to have leakage. So that's where that analogy helps some people understand how tightness can actually make you leak more.
Yeah, that makes sense. Okay, so let's talk a little bit about so we talked about the muscles. Now obviously we've got all these organs in here. We've got our bladder, we've got, our bowels, and then we also have got our uterus and little tiny ovaries over to the side. They aren't really putting pressure on that pelvic floor, but a lot of women experience changes in bladder function and everything else, especially if they've had a hysterectomy, because we're missing an organ that sort of helps prop everything up. Let's talk a little bit about that and what's really occurring there too.
Yeah, as you mentioned, I mean, if we go and take the uterus out, things are just going to want to occupy that space. So they can potentially start to fall down a little bit. So whenever possible, if I can see someone preoperatively to at least get them on board and get them understanding what that diaphragmatic breathing is like, what that pressure management is like prior to having their surgery, and then afterwards, it's really important to come in to relearn how to use those muscles properly. And because your body, I mean, it's an amazing machine. It's incredible when we actually think about what it does for us every day. But we just need to kind of get the muscles working in a different way so that you're not more vulnerable for what's called a prolapse. It's basically what you're mentioning is as those organs kind of can start to fall down a little bit. But as a
Yeah,
pelvic
because
PT, we help with that as well once women have a prolapse. And there's things such as pelvic PT, but then there's also things like a pessary, which is a device that we can insert that will actually help things up. So there's many options. I think for me, that's one of the most important things. There's so many times women suffer in silence and they don't even know that there's options that we could be making this better.
right, and we know that a lot, surgical interventions, nobody wants an organ taken out, and nobody wants something inserted in them, right? That's the reality, and for some women, a bladder sling might be like a godsend, but for a lot of women, it has. I mean, we've got class action lawsuits. It's got its own, risks and things because you've got this foreign body inside your body, and that mesh can be damaging. So, if somebody has these problems, I would say for sure before they do surgery, they need to explore PT to try and make sure that their body is operating properly. So this brings me to another question because you were talking about, the only time you actually exhale and push out is during childbirth when you're bearing down. How many people do you see that actually don't breathe correctly? I
Almost
know I see it. I
all
can
of,
watch yeah, I watch them when they're sitting
yeah,
in the room with me, when I'm in
yeah,
person with somebody and I'm like, "Okay, yeah, you're not breathing properly." So
yeah,
let's talk about that because it's a real situation. People are like, "Well, I'm still alive. I'm breathing. Come on, Betty."
yeah.
You know.
Are you tired of feeling constantly fatigued, overwhelmed by stress, or struggling with energy crashes? So I want to help you reclaim that vitality with my Metabolic Blueprint 28-day adrenal health program. Here's what you're going to get: natural energy boost, stress reduction, balanced blood sugar, enhanced mental clarity, and a very, very good start on rebalancing your adrenal function to help with hormone balancing. Here's what's included. There are 3 nutritional products: Energy Boost Mastery, Stress Less Mastery, and Blood Sugar Mastery. These 3 products synergistically help modulate your stress response, improve blood sugar control, and induce relaxation. You'll also get access to my Metabolic Blueprint app that includes personalized health goals, tracking, and daily wellness and guided nutrition through my Metabolic Blueprint 28-day adrenal program. And for a limited time, I don't normally do this, I am going to also have 3 masterclasses with anybody who takes the 28-day program. And we're going to have live Q&As so we can talk about hormones. You get the entire adrenal health program, the 3 masterclasses, and the supplements for $180. Join us today, because if you do, you'll be registered before the January 20th, 2025 start date. And so all you got to do is go to the link in the show notes of metabolicblueprint.com, hormone adrenal health program, and click the link and you can register and you will get all of those bennies. And again, it's only $180. And I look forward to seeing you January 20th.
Like you said, breathing. It's really important that we breathe correctly. So I use this as a model for when we inhale, everything expands. And then when we exhale, things come in. Just like that. So having that understanding from a pressure management is really important with your breathing. So yesterday I was at a holiday expo and it was great because some kiddos came up and I showed a little boy, I think he was maybe 5 years old, how to use this in the inhaling and exhaling. And then he went around the expo with his mom and then he came back. And I said, do you remember how to breathe? And he did it right. So it was fun too, because there's also a school counselor there who uses one of these. It's a stress ball for you, those of you on the podcast. I can't see. It's one of those balls that really expands wide. If you want to visualize like blowing up a balloon, that would be the inhale. And then when you let the air out of the balloon, that would be the exhale. So having just breath alone is so important. And then we could go into, with that, we'd even touch on, you mentioned like digestion, things like that. So some of my clients, they'll have issues with constipation. And that's, once again, it's, we need to be in a more of a parasympathetic state, if you will, so we can rest and digest. And so teaching people just deep breathing. Sometimes there's the 4, 7, 8 breathing. There's box breathing. There's different types of breathing. And if we do that breathing, we can get parasympathetic nervous system on board, which is rest and digest, and potentially help with some maybe gut motility and get things moving. Because constipation's another thing I treat often. Those pelvic floor muscles being tight. There's a muscle called the puborectalis that's actually like a sling around the rectum. I'm using my anatomy diagram here for those of you on the podcast. But you can imagine if it's a sling and it's a tight muscle, then that can also create sometimes painful bowel movements because we know it's going to hurt. So then we tense up even more. So having that knowledge of just deep breathing to kind of get that pelvic floor to relax doesn't just help with urinary leakage. It also helps with bowel movements as well. And I joke around, I think when Betty and I first met, one of the things I said is, I can tell a lot by people if I ask them 2 questions, and that's how are you pooping and how are you sleeping? So it's all
Totally
connected.
It's all connected. It's funny. So I'm going to be really tacky, but people that listen to my podcast know that I have somewhat a dark sense of humor. So I always joke that basically anal muscle, the sling around, is the smartest muscle we have because it can tell the difference between air, water, and solid.
Yes.
Right?
Yeah,
but if it's
the
tight,
sphincters.
it's not going to let much out.
Yeah,
It's
yeah,
gonna be like,
absolutely.
Thank
Yeah,
God.
that's a great
Otherwise, that would
point.
be a mess.
Yeah. So our external sphincter, we actually have control of, so if you're at a party and you think you're going to pass gas, you can kind of control it and hold it in. But your internal sphincter is an involuntary reflex. We don't have control. And there is what you said, the sample reflex, that our body, when something comes down into that area, it samples it. Is this water? Is this liquid? Is this gas? Is this solid? And so our bodies are really amazing at managing that. And along those same lines, it's really important too, and I find this a lot with like teachers, people in healthcare, even little kiddos. If we hold our bowel movements then we actually dampen that reflex, and we don't even realize like when we need to have a bowel movement. So that's a big piece of pelvic health is education. And when I see clients, I'll have them fill out a diary for 2 days in a row, everything that they eat and drink, and really look at some patterns there.
Yeah, yeah. I'm glad we talked about that. So, because it is very common. Women are like, I have been constipated all my life, or, and just how that can be both structural and digestive function and a bunch of other things. So let's dive in and talk specifically about how the hormones play a role in the changes to the pelvic floor, because this is shocks women, right? They're like, "What happened?" I can't laugh, I can't cough, and I can't do a jumping jack, right? Without risk, because there's things that change. Let's talk specifically about those changes.
Absolutely. And a lot of times I'm usually one of the first people to have this discussion with women, because they'll have said, things are different. I'm leaking more, or intercourse is painful. I'm noticing some changes. And they go to their doctor, and sometimes the doctor does blood work and they say, oh, your hormones are fine. It's, unfortunately, it's all in your head. Like everything looks great, but they're like, I don't feel great. And I heard this story over and over with women. And I finally got to the point where, with all my education and knowledge, I could say, you're in perimenopause, and it happens a lot sooner than most of us realize. And a lot of us at first, it might feel a little like, oh, that means I'm getting older, but hopefully that lasts for just a very short period of time. And then you can be so empowered to know, okay, these changes are happening. It's inevitable. Our long-term goal is to make it to menopause. We all hope to at least live that long and way longer. So now that we know what's happening, there's things we can do to empower ourselves so that we can embrace that time and move through it a little bit easier. And one of the changes is definitely like the decrease in estrogen. So as estrogen goes down, you might notice things like even in your arms, like the skin is a little bit softer, a little bit saggier. So the same kind of thing happens in our pelvic floor as well. With the estrogen changes, the muscles change. They're a little bit more rigid. They're not as supple. And so there are definite things that we can do to help with those muscle changes. And one of the first things is usually just moisture and dryness, I see. And so if people are experiencing dryness and having what's called dyspareunia, which is painful intercourse, simply using a lubricant is sometimes enough. But what we should know about lubricants is they're short acting. It's like putting on chapstick, it kind of makes your lips temporarily feel better, but it's not long acting. Like we talk about our skincare, we moisturize our face, and that's more for preventative. That's more long acting. So there are products like hyaluronic acids where we can use to create more moisture in the pelvic floor, which can then definitely decrease your risk of having pain, because if that tissue is moisture, more supple, things can kind of slide and glide and move easier in that area. Beyond that, there are definite hormonal changes that happen that we could get assistance with. I think at Dr. Betty's clinic, they have providers that can help you with that. So we can get some vaginal estrogen, estradiol on board, and that can help improve the tissues in that area. And I've seen many clients where, I teach them how to use their muscles properly, but that missing piece sometimes is a hormone, because I correlate it to when we work out and we do all this bulking up, all this strength training. If we're not eating enough protein, we're not going to get as strong. So I can teach you how to use your pelvic floor muscles properly. But if we don't have the right kind of environment, if the hormone levels aren't at the right level, then they don't work as efficiently. And I often have clients that, that's the missing piece. They just need a little potentially vaginal estrogen. And they're like, oh, now I don't get up at night anymore to urinate, or my leakage is so much improved. And then there's tons of research. And as we mentioned early in the podcast, we're a little behind in women's health, and we didn't start studying women until 1993. And we are doing more research, and we have found the best vaginal estradiol can prevent UTIs. And I've worked in many parts of physical therapy, and one of them was home care. And when you go to an older patient's home and they have a UTI, it doesn't present like when we're younger. First thing you'll see is cognitive changes. I remember the first patient I saw, I thought, did they have a stroke? What happened? So these hormones can play a big role in actually preventing UTIs, which ultimately can prevent things like sepsis, which can actually be deadly.
Absolutely.
Yeah. And then to touch back on the urinary leakage, I find a lot of women will stop working out because they're leaking. And so they're like, well, I don't want to work out anymore because I'm having leakage, or I'm not going to jump on the trampoline with my kiddos. And so then it's impacting their life, their family life. And they stop working out. If we stop working out, we know then we're at higher risk for falls if we lose strength. And many of us are hopefully starting to look at longevity and look at our health span and how can we improve that? And that's by continuing to work out and do lots of strength training. So my goal is to empower women, teach them how to use their pelvic floor so that they're not shying away from working out because they're afraid of leakage, because there's so much we can do about it. Many of us grew up with our aunts, just like, at least in my family, crossing their legs whenever they coughed or sneezed. And we're like, oh, this is just normal. This is what happens when they get older. And I'm here to say, just because something's common, it's not normal. There's many things we can do to prevent that.
Yeah, I think there's so many things to kind of unpack there. I think, what the stats are like 80 to 90% of UTIs in an older woman can be mitigated completely just by using vaginal estrogen. And you're right. It's one of the biggest killers of women, particularly if they're in assisted living or skilled nursing, because it doesn't present. And they assume, I've had this own experience with my own mother, that the person is starting to have symptoms of what they call decompensation. So as their disease state is getting worse, they think that's what's happening. And it's like, no, 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 no. They have a raging infection. And if you don't get it under control, it may very well kill them. So on that side, it's protective against, and even vaginal yeast infections, because everything dries out, the pH of the vagina changes. But it's so important for women to also understand that vaginal estrogen works locally, and it protects and works in the vaginal tissue and in the tissues around it, but it's not a systemic effect. So even if they're, nervous, they shouldn't be nervous. And especially if they're listening to my podcast, they should know that. But if there's still some nervousness, vaginal estrogen doesn't run around your body and do anything else. It stays right there and is super, super helpful. And the other thing is loss of progesterone and estrogen. We have at least a 30% drop in collagen production, which affects our ligaments, tendons, and everything else, not to mention saggy skin. And everything dries out everywhere, everywhere. And so think of it that way. It's a major lubricant. So I think that's important too. So so we touched a little bit on sex and kind of dryness and things like that. I would assume also if a woman's having pelvic floor dysfunction, like tightness and things like that, it may also be structural, more so than even just the dryness too. And obviously there's PT things they could do with that as well.
Yeah. Yeah, definitely. I mean, not everybody that I see that has pain are the older in perimenopause or menopause. There's a condition what is called vaginismus, and that's actually where the muscles of the vagina kind of go into a little bit of spasm. And so with that, we have to teach the muscles how to relax. Once again, we're back at diaphragmatic breathing and teaching women how to, and men too. I shouldn't just say women, because men have pelvic floors too, and this is universal, how to relax their pelvic floor. And sometimes it's trauma based. It could be potentially, I'm in Northern Virginia. I see a lot of women that ride horses and have been tossed off horses and fractured tailbones and things like that. So there could be some tightness from injuries when we're younger that could be causing some of that pain. And so teaching those women how to relax those muscles. And the other thing a pelvic PT can do is use devices called trainers, which we can actually use, which one that I use is called a pelvic wand. And so we can teach clients how to use this trainer to go inside the vagina and actually, with lots of lubricant, get the muscles to relax. But it's very empowering. And one of the most important pieces is getting a woman's nervous system to recognize that when you're going to be touched in this area, it doesn't always have to be painful. So going way back to just deep breathing, relaxing, and helping couples, people go through this journey together and getting them to a place of feeling much more confident with their bodies and not being afraid to have possibly intercourse because of pain.
Yeah, because it's still such a rich part of our lives. It's funny because a lot of people will believe that, oh, I'm in my 50s, like I'm 55, that's kind of a dead part of our sexuality. And I would say, given supporting your body appropriately, it's probably one of the most liberating and best sexual times of your life if you have all the right tools and the right things to make it pleasurable. Because I think the beauty of being in this time period is we don't give any fucks anymore. We don't care.
Yes.
We feel more confident and comfortable in our bodies often, or we're working towards that, which allows a greater bit of sexual freedom. I don't know about you, but when I was 25, to 30 or whatever, let's say, I was always like, what does my belly look like in this moment? Do I look funny in this position? You know what I mean? Like the stupid stuff
Yeah.
that goes through your head that has no meaning in the moment, but because of our societal activities, I think most women will say, yeah, I was thinking about that. Like, what do I look like in this moment? Which takes
Yeah.
you out of the physicality and the beauty of sex and puts you into a judgmental experience of your own. Wouldn't you say that's true?
Oh yeah, absolutely. And I think I probably shared with you, I just turned 50 this summer, and yeah, it's so liberating. We get into this part of life and we are just so empowered, and we don't really care about those things as much anymore. We're still caring, we're still very empathetic, but there's just this freedom. And to think what the life expectancy has changed, before, I think it was the early 1900s, women were only living to like their later 40s potentially, and now we're living like twice as long, and we want to be able to enjoy that time.
Yeah.
So yeah, that's a really important point. And just because we're 50 and things might be changing, it's called the genital urinary menopause syndrome. Yeah, that the tissues may be changing there. There's many things we can do to make the tissues feel more comfortable and empower you to want to continue to be intimate with your partner or however you choose.
Right. Exactly. Yeah. Because that's still a
Yeah.
huge.
And that's another important piece
Yeah.
is like when we talk about pelvic health, like having orgasms, that's really important. That's basically working out your muscles. So that's a really important piece to pelvic health as well. And I'm going to be giving out a free freebie with some tips and tricks for pelvic health, and that's going to be one of them on there.
Have more orgasms, ladies. That's the important part.
Yes.
Exactly. We should be having lots of orgasms. Either with yourself, with a partner, doesn't really matter. Just more orgasms because it's good for your health. So you heard it here. You heard it here first.
Yes.
For sure, for sure.
Yes.
So if you were to leave my guests with like, 2 or 3 tips, things they could possibly do on their own, maybe to explore whether this is an issue, because I would say the other hard part is in a lot of places, if they're not near you or they might have a hard time finding somebody who actually specializes in pelvic floor, which not every PT, I think we need to qualify that. Not every PT is a pelvic floor specialist. So what are some things
Yes,
they could
that's
do,
true.
and sort of assess themselves?
Yeah. Yeah. So one of the things, some general tips that I give people is if you're urinating, we should be urinating about 5 to 8 times a day. And so if you even wanted to monitor that for a couple of days, like I have my patients do, and just see if you're like going 10 to 12 times a day, you might be urinating potentially when your bladder's not full. So there's things that we can do to teach like a little bit of urge suppression. Once again, without knowing somebody individually, I don't want to get someone suppressing so much they dampen their reflex, but yeah, you would want to look at that. I had clients who every time they're getting ready to leave to go get the kiddos from the bus or go to the store, they do a just in case urination. So just in case they start they go to the bathroom. So I would look at your frequency. How often are you urinating? Is it more than 5 to 8 times a day? How often are you doing the just in case? And I usually say to clients, I'll give you one just in case, and that's before bed at night. Like we don't want that to wake you up. So I'll let them have their just in case before bed at night. And then the other thing is if you're having difficulty initiating urination or you feel like you're not fully empty, that would be another reason to seek out pelvic PT. Same thing with bowel movements. If you're having difficulty initiating or you're not fully empty. And there are a number of therapists, pelvic PTs, that do virtual consults. So even if somebody's not in your area, that is something you could definitely look into.
Yeah. So I think it's important to just know that there's options out there and that you don't have to sit and suffer. I'm glad you brought up that sort of just in case, because I have 2 times before bed and then if I'm getting ready to go cycling, because that's uncomfortable, number 1, and then they're porta potties, and that's a big no. Like, I don't want to have to use porta potties. So I
Yeah.
always have what I call pee hysteria right before I leave the house. I'm like, hold on, one more time. I gotta do that.
Yeah.
So, well, awesome. So we're gonna have a link to your freebie. So, some good, rich information for the ladies. Now, where else can they find you online if they want to look you up? Maybe they're in your area.
Sure. So I have a website. It's pearl, like the jewel pearl, PEARL hyphen physical hyphen therapy.com. So that's my website. And then on Instagram, PT Kim Dixon. So PT, short for physical therapist Kim Dixon on Instagram. And Dixon is Dixon.
Awesome. Awesome. Well, Dr. Kim, it's been awesome.
You'll see me if you
Oh, go ahead.
Yeah, if you take a look, I was dancing with my pelvis yesterday on there. So I try to keep it light. I know this topic can be a little heavy for some people, so I am a little like quirky at times, and I want to make people feel comfortable and that this is a topic we can talk about. So I try to keep it lighthearted when we can.
Yeah, and Dr. Kim and I met at the Pause Symposium in New York City. What was that? Was that early October or late September? I can't even remember what it was.
Yeah, October.
Yeah, it was October, and it was great. So we met, and we were like, "Oh, we love each other. We need to stay in contact." So, yeah. So definitely, definitely, everybody look up Dr. Kim, and I hope that if you're having trouble in this area, that you actually explore it, because you shouldn't have to suffer with pelvic floor issues. So thank you for listening to Menopause Mastery, everybody, and we'll be back with you next week.